Good evening, folks. Welcome, welcome, welcome. You are listening to Saving Money Unapologetically with your host, PG. That is me. Good Thursday evening, everyone. Hope you're all doing well. I wanted to come on this evening to announce a bit of serious news that will probably affect many um, individuals who have a Cigna Healthcare or a Medicare Advantage plan in the state of Georgia, as far as I know, in the state of Georgia. And if you are a Piedmont patient, a Piedmont affiliate patient, such as all of your medical records and tests are done over at one of the many Piedmont um, hospital locations in the state of Georgia, or if you see doctors under the Piedmont Healthcare system and have um, Cigna's Medicare Advantage, one of Cigna's Medicare Advantage plans. And there are many Advantage plans that Medicare offers, and Cigna is one of the providers of that type of plan. I wanted to come on and discuss this evening. As you can see, I have Cigna on one side, Piedmont Healthcare on the other, and I have the date of March 31st of 2025. And as you can see, someone is holding up a contract and they have torn it in half. Meaning, PG, what does that mean? Well, I'm going to tell you, because a lot of people have been basically saying that, oh, they're just canceling the contract and going to renew or whatever. No, the contract between Cigna Healthcare and Piedmont Hospitals, doctors, clinics, even the Cancer Institute under the Piedmont umbrella, those ties are being severed, ending March 31st. This is a public service, basically, announcement so that I can get it out to the masses, especially here in the state of Georgia, about this, because it is critical. If you have or go and see certain doctors under the Piedmont system and you know that you have Cigna's Medicare Advantage plans, then you need to hurry and make other arrangements. Please call your doctor's offices and please call your insurance provider. The number is located on the back of your insurance card, or you can go and Google that number. Do whatever you need to do way before March the 31st, because you will no longer be able to see those physicians that you have been accustomed to seeing, because they will no longer be accepting Cigna's healthcare plans under the umbrella of the Medicare Advantage part. And that is effective March 31st. And it will affect all Piedmont hospitals and physicians in the Piedmont clinics, including Piedmont Cancer Institute. Again, I want to reiterate, this is very, very important, folks. Very important. From what I gather, the contract renewal basically failed, and they have been working on this since June of 2024, trying to come to some type of resolution. But however, Piedmont Healthcare and Cigna were unable to reach a resolution for a contract renewal for Cigna's Medicare Advantage plan. The end date, again, is effective. The plan will end, or the ties will sever. The contract will be terminated between Cigna and Piedmont Healthcare effective March the 31st of this year of 2025. Again, please, this applies to all Piedmont hospitals and all physicians under the Piedmont umbrella, as well as the Piedmont Cancer Institute. If you can get some type of authorization or prior referral from the insurance company deeming that, it would be a hardship for you to go out of the Piedmont system, they may be able to give you some relief, maybe for 3 months, 6 months, 9 months, a year. I don't know, because each individual, when you go to advocate for yourself, will be different. Some may get an authorization approval for 6 months or a year. Others may be refused or denied. Cigna in itself has had a history of working with Piedmont. However, over the years, um, things have kind of started to go south, as we all know. The healthcare system, the current administration, there's so much that's going on, and I don't know if the new administration has had anything to do with this, where they can't come to an agreement on the contract. I know last year Humana and Piedmont was going to sever ties, and at the last 72 hours or whatever that was left before they were going to terminate their contract with Piedmont and Humana, they came to some type of agreement and was able to go forward. There was a multi-year contract over the some years, and then they went back and went to just I guess a year to year basis. um, you know this will affect a lot of people. There's, in the Piedmont system alone, I know for a fact that there's at least 2,000 plus physicians under the Piedmont umbrella who practice medicine on a daily. Now, what does that mean? Like I said before, I want to go over this because this is important. That means there's a difference between terminating a contract and canceling a contract. When there's a difference. And when you terminate a contract, basically both parties have agreed to walk away from the table. And whatever those parties agreed upon, whether monies were owed or whatever, they have come to an agreement to either pay up, pony up, or whatever, or take their losses and move forward. Now, we don't know. Like I said, this started back in June of 2024 when they began to work together with Cigna. Piedmont and Cigna began to work together, on the renewal of the contract for the upcoming year, which would be this year that we're in now, currently 2025. And it's unfortunate, at the state of the economy, the state of this country, the state of the nation, just the overall gist of this is not a good time at all. So, what does that mean? Effective March 31st, the agreement with Cigna's Medicare Advantage plan will end, which applies to all Piedmont hospitals and physicians in the Piedmont clinics as well. And that will also include, just in case you haven't really it hasn't really hit you yet or settled into your mind yet or whatever, that will also include freestanding and joint venture ambulatory surgery centers, meaning like same day surgery centers that may be housed somewhere outside of a Piedmont hospital facility. It may be down on Peachtree Street or Peachtree Corners or wherever. Home health will be affected. Home infusion, if you have cancer patients or people that need different infusions, those things will be greatly affected as well. It's tough, y'all. It's even tough for me to come on this evening and announce this and putting it out there for the masses, because some people probably do not know. Did they send out letters? Probably not. I don't know. But I can tell you this, you know, we're in for a long, tough road ahead, and it's going to get tougher as we continue to move forward. You know, there was an open enrollment period, also for certain plans that also will end on March 31st, and that open enrollment also ends. So at this point, you may have to switch plans. You may have to switch provide a whole plan altogether with maybe another company if you're wanting to stay with the doctors that you have been seeing, or the specialists, or both that you have been seeing. um, Time is short right now, but you have to do something. So I suggest, like I said before, get on the phone, start calling Cigna, call your doctors that you have been seeing or have future appointments with, and touch bases with them. Make sure that they have your records, so that if at the final hours before the actual contract terminates totally between the two parties, that uh, if you need to pull medical records and have them go over to another whole system somewhere else, or say Emory here in the state of Georgia, or um, Northside, or whomever you choose, then just let's make sure that you have all of your ducks in a row, and there is still time to get things together. Um, I know that there is an 800 number that was listed in the 3 articles that I did read that were current. The phone number that they gave out for Piedmont themselves, if you had any questions about maybe how to do it. They're not going to be able to answer any questions about Cigna, but they will talk to you about what you can do to move forward, as far as not being able to see the Piedmont physicians or go to those clinics, the ambulatory clinics, or the same day surgery centers that are, standalone buildings, or having the home infusions done, or if you're going to an infusion center or whatever. There is a call center that they have set up specifically to answer any questions that their patients have. And that number is 1-800-675-2186. Again, the number to Piedmont's call center that they have set up to answer questions from their current patients that may be or are affected about this change and terminating of the contract between Cigna and Piedmont. They have set this number up, and the number is again 1-800-675-2186. Piedmont Hospitals have contracts through 2025 with the Medicare plans. And some of those plans that are still in effect and will be in effect until December 31st at 12:01. Those plans include that they are accepting at Piedmont, which would be Aetna, Anthem, MediBlue, Care Source, Dual Advantage, Clover Health, Clear Springs Health, previously Eon Health, Georgia Health Advantage, which is American Health Plan, Humana, Kaiser Permanente, or just Kaiser, Pruitt Health, Premier, which is the Align, Sonder, and United Healthcare, as well as WellCare. Again, I'm going to go over who Piedmont Hospitals and all of their contracts and associates under the Piedmont umbrella is still accepting these particular plans of insurance through 2025, which means in December 31st of 2025, the current year that we're in. It's traditional Medicare, which is just Medicare, no Medicare Advantage plan, just raw, regular Medicare, provided by the Center for Medicare and Medicaid Services, Aetna, Anthem, MediBlue, CareSource Dual Advantage, Clover Health, Clear Springs Health, previously EON Health, Georgia Health Advantage, American Health Plan. Georgia Health Advantage used to be called American Health Plan. There are still some people under the American Health Plan. I think they were probably grandfathered in or something. Not sure. Don't quote me on it. Humana, Kaiser Permanente, or just Kaiser, K with a K, AISER, Pruitt Health Premier, Ally Align, Sonder, United Healthcare, and WellCare. Now, here's the thing. If you're going to choose to stay with your Cigna Medicare Advantage plan, the Piedmont Cigna Medicare Advantage contract termination has different implications depending on whether you as the patient have a PPO plan or an HMO plan. This is getting a little deeper, but I wanted to skim this for all of my listeners and all of my loyal subscribers in case this affects you. Listen up. It says again that if you choose to stay with your current Cigna Medicare Advantage plan, the Piedmont Cigna Medicare Advantage contract termination has different implications depending on whether you as the patient have a PPO plan or an HMO plan. If you have questions about that, please contact Cigna Medicare Advantage at the number on the back, like I said, of your member ID card, or better known as your insurance card. They also said in my notes here, I'm looking that for patients with a PPO plan, you can continue receiving care at Piedmont utilizing the out-of-network benefits that are connected to the Cigna plan. However, some people may have maybe a zero deductible, a zero copay when they go to see their PCP or primary care. Now, when you go out of network, meaning if that provider of the services that you're trying to get no longer accepts that plan, then that means they can still treat you, but you will not be in network. Therefore, whatever that cost to you is, you will be expected to pay that upfront before they will see you. And Piedmont will not know how much that is. Only your insurance provider, which would be, I'm assuming, Cigna, that's who we're talking about, the Medicare Advantage plans, PPOs and HMOs, will be able, if you call that number on the back of your insurance ID card or insurance card, they will be able to tell you if you have to see a specialist or if you want to continue seeing those particular specialists and you were paying $20, that particular specialist out of network may be $100. It may be $75. It just depends on the plan that you have. Okay? So let's make certain that we know what we're doing, and let's make certain that we are totally up to par and informed and not uninformed, because when you're uninformed and you go half cocked, then we make bad decisions. But if you gather the information, try to absorb what you can, and please ask questions until you get a answer that you are comfortable with, as far as, maybe ask the same question a couple times at different times a day when you call or whomever, so that you can kind of compare what they've said, take notes, and then you can make your decision moving forward, folks. Again, the patient should call Cigna with those type of questions. Now, If you have Cigna and you have to go to the emergency room because it is an emergency, okay? If you have to go to the emergency room because it is an emergency, not a splinter in your finger, not, oh, woe is me. I don't even have a PCP, primary care physician, and I go to the emergency room for everything because I'm rarely sick. You may have to pay an absorbent amount because you are no longer in network. They will do what they can for emergency medical assistance to you, the patient. Yes. It's not they're going to turn you away, but you may walk away out of there or whatever with a very large bill. So please do your due diligence, folks. Thank you for stopping in and listening to me this evening. You are listening to Saving Money Unapologetically with your host, PG. That is me. But do your due diligence and call Cigna, the number on the back of your insurance card. If you are an HMO patient, meaning, or plan patient, meaning if you're not on a PPO, it's going to say on the front of your insurance card whether you have a PPO or whether you have an HMO. If you have an HMO, the coverage may be impacted for non-emergency care. To verify if non-emergency services are covered by your Cigna Medicare Advantage HMO plan, you should call. Again, Cigna. Don't call over to Piedmont. They want you to call Cigna to ask that question. All emergency care for patients with an HMO will be covered at in-network benefits. However, it is still based on the existing Cigna plan that you have. So please call Cigna and find out. Now, there is some uncertainty whether or not certain services will be covered by Cigna Medicare Advantage to HMO patients. They're saying that I read. I have this in a highlighted. So it says who are scheduled for hospital services after March 31st. So if you know you have a procedure such as maybe, let's say, a colonoscopy, and that colonoscopy is scheduled, let's say, April 15th. All right. Or for ladies, if you have a mammogram scheduled and it's scheduled for April the 3rd, then there's some uncertainty whether or not, like they said, you will have to consider self-pay. So it may behoove you to go ahead and call the hospital and say, hey, I had a procedure already scheduled, and since the contract is being terminated between Cigna Medicare Advantage and you guys, what would my estimate self-pay cost to have my mammogram or to have my colonoscopy? Be prepared, folks. It's not going to be cheap. We all know that usually breast cancer screenings or mammograms and colonoscopies and things like that, usually with the Medicare Advantage plan, those are called preventive measures or preventive testing, so that they can prevent an early screening and early detection. So usually it's normally zero cost to the patients. But because you will no longer be in network with this, they may do self-pay and make you, the patient, pay. So please call now when you can on the next business date, which would be tomorrow on Friday, or as soon as possible, to find these things out and to go ahead also and cancel those appointments if you need to. Now, continuity of care everybody knows continuation of care. That's what that means. Continuity of care. Patients who are undergoing or ongoing medical treatment should call again Cigna and verify if their medical condition is covered under continuity of care benefits, meaning, say, cancer patients. They don't want to disrupt if you're receiving infusions or chemotherapy or radiation or a combination of both or whatever. See if your plan, if continuity of care will continue so that you can continue your rounds of radiation or those rounds of chemotherapy or those rounds of infusion that you have already been on, because they don't want to disrupt that. Please call and make certain. Please call Cigna. I gave out the Cigna number a bit of go. I didn't give out the Cigna number, but I did give out the Piedmont number a little while ago. Cigna has various numbers. Please Google it or just look on the back of your insurance card and call that number on the card. Speak to a care agent or a customer service representative or somebody that you can, discuss your questions with. Because there is certainly something called continuity or continuation of care. Now, whether or not the continuity or continuation of care benefits are extended to you, it depends on your plan. Most of the times, most plans, especially if it's a life-threatening procedure, or if it's life-threatening and you've been diagnosed with something and you need this care, like chemotherapy, radiation, like I said, infusions, injections, whatever, usually those plan providers such as Cigna, the insurance company, are usually will treat that round of chemo or however many rounds you still have left, or radiation, or whatever it is you still have left to do. They will usually do it at the same in-network level for a specific period of time. And it is up to you to find out what the specific period of time is. It may be 3 months, 6 months. It may be, I don't know, 120 days. I don't know. You have to find that out, but I'm just putting it out here, folks, adding food for thought so that you can make sure that you are asking all of the necessary questions that's going to pertain to you or your loved one or your spouse, or the both of you may have Cigna. Who knows? I don't know. But the disruptions that this is going to cause is definitely going to be frustrating. It's definitely going to be a little bit difficult, or a lot difficult. A lot. When there's new information, Piedmont themselves has promised to share the new information as they receive it, as far as whether or not the plan has, the contract has been saved, or they're going to go forward, but they have the projected date of it ending, which would be March 31st of 2025. Right now, truly, folks, that's all I know, but I wanted to make certain that I touched on everything here in my notes, and the highlights from several articles that I read, and on the Piedmont's website about this. So, again, Cigna Medicare Advantage plan and Piedmont Hospital and all of their affiliate clinics, standalone same-day surgery centers, infusion centers, and all will be no more accepted by them as far as Cigna Medicare Advantage plan is concerned after March 31st of this year. So please call Piedmont with the questions that you may have for them as far as elective surgeries or surgeries that have already been scheduled for you after March 31st, or preventive screenings that may have already been scheduled for you after March 31st, you can call Piedmont on and find out. But also you want to call your insurance provider and see if there is continuity of care or continuation of care, especially if you are on certain medications or certain life-saving treatments, such as cancer treatments, um, infusions, um, radiation, uh, maybe stem cell transplant patients for different things. Yeah, please make sure you do your due diligence. You may have to cancel, or you may call the business office and get an estimate of the self-pay of how much those preventive screenings or tests will cost you, if because you will be out of network. Whether or not you're going to choose to continue on and go anyway and pay out of pocket, that's solely up to you. No one can make you do such, but just know that if you liked going to Piedmont and liked their physicians or had physicians and other medical staff that you were accustomed to seeing, that this will affect you if you have a Cigna Medicare Advantage plan. That's all I have for today or this evening, folks. I hope that you are all doing well. I hope that you move forward with whatever decisions that you make. Please don't make a hasty decision, but you are really in need of making some kind of decision really soon. Make sure that you call and ask any questions from both providers, the healthcare providers, which would be Piedmont and their affiliates, as well as calling Cigna and speaking to their patient and care representatives that can further assist you with answering specific questions that I cannot. I can only generalize. I'm not the healthcare provider, nor am I the insurance provider. So, I've given you as much information that was available to me and as much information that I thought that would be beneficial to anyone that may come across this vlog or podcast who has Cigna in the state of Georgia and who uses the Piedmont system for their medical treatment and or preventive testing and screenings. It's been real, y'all. Thank you for tuning in. Please don't forget to hit that thumbs up button. Please share this vlog and podcast with family and friends who you think may benefit from it, or who you know for a fact that has Cigna, in case they don't know, or in case they didn't hear everything or haven't read a whole lot up on this situation that's going on, that's going to take place. At least this will give them a small summary, and they can move forward by making the phone calls or going online and maybe chatting with a healthcare representative from Cigna, and or also calling over to one of the Piedmont hospitals or facilities that you frequent and your doctor's offices, so that you can make the right choice and the right decision to move forward with your health. Thank you for tuning in. You have been listening to Saving Money Unapologetically with your host, PG. That is me. Bye now.